Welcome to medicsvoices.com, where we talk to the key opinion leaders in health and medicine around the world. Today I'm talking to Evert Verhagen, who's one of the world's leaders in sport and exercise medicine. Evert, you're leading one of the very select group of Olympic sports injury centres. Tell us how you got there.
Oh, I think I tend to think it's more luck than wisdom, to be honest. And it's basic in our core DNA to be motivated and energized to provide healthy activity for all. That's what we've been doing for many, many years now. And out of that, we keep coming with new ideas and new questions and new solutions that no one ever thought of before. And I think maybe that's our luck, that we provided ourselves with such a place here within our university to have that freedom to go any direction we want. That keeps us on the forefront of things and keeps us asking the new questions that no one dared to ask before or could not ask before. And maybe that's what got us a seat at that select table, to be honest.
Now, you've done some super research. Tell us about your own research trajectory.
I started with trying to figure out how we could use balance exercises to prevent ankle sprains in volleyball athletes. A lot of ankle sprains in volleyball. There's a lot of jumping going on at close proximity of a lot of players. So landing on foot or landing awkwardly was common. It still is common. So we thought, let's see if we can reduce that a little bit. And to be honest, that was my master thesis when I was doing my master's in sports sciences here in Amsterdam. And out of that came an excellent result, much to my surprise, to be honest, because we didn't do much, but it seemed to work. And out of that, we got a second grant to follow that up with a more specific research question. Out of that came another interesting result, and that followed up as well. So kind of, again, out of that curiosity, we managed to do a lot of work on injuries and injury prevention and keep pushing the boundaries of what we think we knew and be surprised with our own outcomes and ask new questions about it. And I don't know if you want to call that super research. I think basically we're just having fun and trying to find practical answers instead of stay with our heads in the lab and try to figure out how things work on a square millimeter. We try to go outside and see how things really work in practice and are a benefit for the athletes.
Well, as your own research career developed, you made collaborations with many other researchers around the world. And indeed, in Amsterdam, you have a tremendous collaboration with lots of different units. Tell me how that collaboration developed.
Kind of organically, like the rest of the story as well. You go to conferences, you talk to people, you see other people's work, and you're interested in how they did it, why they did it, and how they interpreted their results or what their challenges were, because you want to improve yourself, you want to improve your own work. And out of that, you create friendships, you create a network, and you create long-standing collaborations of like-minded colleagues. And that doesn't have to be necessarily researchers. There's clinicians as well. There's students as well who go any direction. And that's a lively network of people that you drag along in your pathway. Drag along sounds negative, maybe, but I mean it in a positive way. And they keep inspiring you. So what I try to do is connect them with each other. So past collaborations, current collaborations. So once you're in the network, you're not out of it. So I keep nagging you. But that's a really lively conversation, and new things keep popping up, new ideas keep popping up. And I think the philosophy of that is think out of the box and think out of your own box, mostly because there's so much out there that you haven't thought of yourself that other people can think of, can help you with, and use that.
I'm very interested in this idea of thinking out of the box and bringing in different ideas, because now, as a medical journal editor yourself, you're faced with lots of different areas outside your own field of research. I mean, there are huge challenges in sport and sports medicine at the moment. We have the problems with looking at drug taking, at gender alignment, at concussion. What are your thoughts on these particular areas?
It's difficult to keep track. Our field is growing exponentially, let's be honest. You just ask how I started, and I think I'm not saying anything strange when I say that in the year 2000, when I started, this field was really small. There was like, a handful of people doing research in our realm. And now there's so many scientific journals and meetings and colleagues and peers, and it's so hard to keep track of it, which is amazing, because that means the topic we're so interested in is broad and vast and deserves attention. So that's awesome. But keeping track of that requires a lot of specific expertise, skills, and knowledge. And that's difficult to have in one person. So I tend to be a generalist myself. I try to understand what research is. I try to understand what these topics entail. So to be able to connect the dots. And I surround myself within my own little network, we just talked about, but also in my professional network, for instance, for the medical journal. With people who have the expertise and who can tell me whether some specific small part of that topic is of interest or novel or correct or valid. And I think that's needed. You need that broad array of specific expertise and skill set around you. And you also need those people who can connect those skill sets and those expertises to each other. And I think together then you can get a good vast array of where it's all heading. The problem is, and now going to your question, how do I look at these topics? It's so easy to be, the one-eyed king in the land of the blind with new topics. And I see that happening every now and then. And I think that is something we have to be aware of. Always be critical and don't accept those new topics for its value. If one or two people are doing a lot of work in there and trying to grow that field, always be critical and ask questions, keep asking questions.
Now, you talked about skill sets there. And one of the things that intrigues me is that you're an epidemiologist by training, but actually you've taken a turn in the road and you're quite interested in qualitative research. Tell me about that interest and how that combines with your epidemiology.
Well, I think those two are really, they're not mutually exclusive. Epidemiology is all about numbers, right? There's less injuries, or there's a higher risk of this, or the odds of that is doubled. But what do these numbers actually mean for the people you do it for? You need to have that understanding as well. And of course, if you look at epidemiology, we don't report just relative risks anymore. We also report the absolute values. So you already put some of our epidemiological outcomes into perspective. But still, it doesn't say anything how these values are experienced by the field and how we can actually make the field benefit from our outcomes. And I think that started with the tremendous effects we saw in our injury prevention trials, where we saw a 50% reduction of injuries when you do the exercises we propose. But we also found no one's doing the exercises. And then we started with surveys. Why don't you do the exercises? What do you need? And then you start to categorize and put frequency tables on answers. And then we thought, now we have the answer. This is where we need to focus on. And still it didn't work that well as we thought it would. And then we figured, let's talk to them. Let's just have an open talk with them and see what are the barriers, what are the facilitators, why don't they use it? And out of that comes such rich data and insights that showed us that we need to turn things around. Instead of us trying to develop what's based on the best evidence, we need to try and develop things that are fitting to their reality. And I usually use the analogy of a race car, because we have all the elements and the nuts and the bolts and the knowledge to build the perfect race car. And we do that. And then we open the garage door, and then we realize that the road we need to drive this on is a dirt road full of rocks and unsteady surface. So what's best, right? You better build a car that suits the context and then have good possibilities there, instead of build the perfect car out of context. And we've been doing the latter, I think, for a long, long time. And we need the qualitative research to do that last little bit.
Putting all these things together, and you as one of the leaders, just finally, what is your message to someone who's starting off in their career and would like to follow a career in sport and exercise research?
Follow your own motivation. Be curious. and don't let anyone tell you what you need to do. And try to be pushing your own boundaries, I think. I say this out of my own reflection of how I got here. I keep saying the word organic. I never had a big plan. I never had a big mission or research vision of where I wanted to go. One came out of the other, and just out of curiosity and a internal motivation to drive the research and to support athletes. We build up what we build up here in Amsterdam. I think that's the reason I still go to work every day with a big smile and the same energy I had when I was that young PhD student.
Evert, I just love that bit of going to work with a big smile. Thank you very much for all your thoughts and reflections on sport and exercise medicine and your huge contribution to the discipline. It's been a pleasure talking to you.
Welcome.